Hello, ma'am. Assalamu alaikum. I'm MD Roman. My ID number 181291207. My presentation topic is natural development of type 2 diabetes mellitus. At first, I want to talk about the introduction of diabetes mellitus. Diabetes is a metabolic disorder which is caused by lacking of insulin or insulin receptor inactivity and characterized by chronic hyperglycemia. Diabetes mellitus was recognized as early as 1500 BC by Egyptian physician who described a disease associated with the passes of mass urine. Then I want to talk about the symptom of diabetes mellitus. There are three main symptoms such as polyuria, frequent urination, polydipsia, which means excessive thirst, and polyphagia, excessive eating or hunger. There are two types of diabetes mellitus, which we found in the world, um, such as type 1 diabetes mellitus, which means insulin dependent diabetes mellitus. In this case, there is a lack of insulin production, which is responsible for metabolism of glucose. Beta cell of pancreas is destroyed by an autoimmune process, usually leading to absolute insulin deficiency. It is also called juvenile onset diabetes mellitus. Over 95% of person mm, with type 1 diabetes mellitus develop the decreases before the years of 25 within an equal incidence in both sexes. Then we want to talk about the type 2 diabetes mellitus, which means non-insulin dependent diabetes mellitus. In this case, insulin concentration in blood is sometimes normal or more than normal or less than normal. Insulin is produced in beta cells but not secreted sufficiently when not working due to due to tissue um, resistance to insulin. There may be decrease in insulin receptor because it's not utilized properly. Then we want to talk about natural product for the treatment of type 2 diabetes mellitus. Recently, various cures and medication have been utilized to treat type 2 diabetes mellitus, including insulin, before information on its mechanism of activity. Some of them have been remembered for the therapeutic profile of medication. A few those compounds have been often from plant or from microorganisms. Examples are galigin, phenolic compound, and psychogenol, often from plant, and agarbots, mignidol, and polyphos from microorganisms. And want to talk about the categories of insulin, which produced from the natural source. Insulin sensitizer, pancreases, target tissue and mode of action. Pancreases increase in insulin secretion, conventional drug, sulfonylurea, which are available in the market, and natural medicine, banaba, bitter melon, and then insulin sensitizers target tissue and mode of action. Liver decrease glucose production, conventional drug, metformin, thiazolidine, dione, and natural medication, agaricus mushroom, American ginseng, and then carbohydrate absorption inhibitor, target tissue and mode of action, intestine, decrease glucose absorption, conventional drug, alpha glucosidase inhibitor, and natural medication in port and blood ileum. Then and to talk about the mechanism action of ginseng to improve glucose metabolism. Ginseng, it is an antioxidant and it's decrease beta cell apoptosis. And ginseng now also work on the CUT, which means the urinary tract. Then it goes to alpha glucosidase activity decrease and also decrease glucose absorption and ultimately it's increase insulin sensitivity and decrease blood glucose. Another further is it decrease hypothalamic neuropeptide. and food intake, and goes to insulin sensitivity and blood glucose decrease. Then it also goes to the LUT4 translocation, which is a receptor, and it goes to in glucose oxidation increase and glucose uptake increase. And to talk about another medicine mechanism, uh, which is bitter melon. Bitter melon, it is an antioxidant, and it goes to beta cell protection increase, and it also goes to the CUT, urinary tract, and increase and decrease alpha glucosidase activity, and decrease glucose absorption, and it goes to the liver and increase hepatic glycogen, and in decrease glucogenesis, and it goes to glucose oxidation increase and glucose reuptake increase. Then the last slide is that the future perspectives and conclusion. Right and interesting approach have been proposed for treating type 2 diabetes mellitus. There are many preclinical studies in animals as well as screening of medicinal for plant used for treating diabetes in different parts of the world. However, the major interest could be the increasing number of systematic reviews on clinical trials developed in recent time. This is all about my presentation. Thank you, ma'am. Assalamu alaikum.